Hey girl gang, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Well Woman Wednesdays. Come on in my office, girl. Let's talk birth control. So you know we've been talking about birth control and we are starting with the most effective methods first. And today I'm going to tell you all about the Nexplanon, which is the implant that goes in your arm. So make sure you keep watching for more details. All right, girl gang, so let's just briefly talk about the Nexplanon. The Nexplanon is one of the most effective forms of birth control, and it is actually a 1.6 inch implant that's made of plastic that has some material in it that actually causes it to light up when you look at it on ultrasound or CT scan. So it's called a radiopaque material. And so it's a very flexible plastic implant that you can place in the arm. And it contains a hormone called edu-tained. And that's a hormone that's released in very small increments in your arm. And so this implant really is very effective because once you put it in, it's in there and it's working and you don't have to worry about it. And it's going to be giving you the right dose of hormone each day. So there is 68 milligrams of edu-tained in the Nexplanon, and that's delivered in small increments over the 3-year period that the Nexplanon is good for. I always talk to people about when they're planning on having their next baby. And if you're planning on waiting at least a year in between babies, the Nexplanon is still a good choice because it can be removed before the 3-year period that is actually good for. So a lot of people wonder, how does it actually work? Like, how does this implant in my arm keep me from getting pregnant? Well, first of all, it actually inhibits ovulation. So that's something to definitely note about the Nexplanon, is that it inhibits ovulation. And so you may take 3 to 9 months to go back to ovulating normally after the Nexplanon is removed. The other way that the Nexplanon works is that it thins out the inside lining of the uterus where a pregnancy would implant. So that is helpful to keep a pregnancy from occurring. But theoretically, if we looked at how conception occurs, if you're not ovulating, getting pregnant would be pretty hard. Third and final way that the Nexplanon works is by increasing the mucus in the cervix that the sperm would have to travel through. So it kind of makes it difficult for sperm to actually get up into the uterus and out into the fallopian tube where an egg would be waiting. But since Nexplanon inhibits ovulation, then there should be no egg there anyway. The Nexplanon is over 99% effective in preventing pregnancy. So if I put 100 Nexplanons in 100 women, guess what? Only 1/2 of the woman would get pregnant. I mean, I guess it had to be the bottom half, right? The Nexplanon is inserted in your doctor's office or in the hospital, and it is one of those birth controls that is progesterone only. Edu-tained is actually a form of progesterone. So the Nexplanon does not contain estrogen at all. So it's a form that can be used immediately after birth. The arm is cleaned with alcohol or betadine or whatever cleaning solution you want to use. And then we numb the arm up with lidocaine. And so we can inject lidocaine at the site to numb that area. And then the Nexplanon has an insertion device that's used to place it in the arm. Usually there's a pressure bandage that's placed for 24 hours after Nexplanon insertion to ensure that the insertion does not cause bruising or hematoma at the arm. So that pressure bandage helps keep pressure on that and keep it from bruising. It's important not to scratch or scrape at a scab where your Nexplanon was placed once you take that pressure bandage off, because the Nexplanon can be expelled if you play with it. So don't play with it. What are the pros and cons? This is a great effective birth control. It's long acting. And so the pros are really that it takes very little effort from you. It is very effective in preventing pregnancy, and it is something that you don't really even have to think about. So it's one of the long-acting reversible forms of birth control. The cons, because the streets are talking out here, y'all. So let me go over these. The first con is that you can have abnormal bleeding. That's the most common side effect of a Nexplanon, is abnormal bleeding. So irregular bleeding between periods or just irregular bleeding without regular periods can certainly occur. And there are things that we can use to decrease that abnormal bleeding if that's bothering you. I hear a lot about weight gain. Based on the studies that we have done in Nexplanon, it does not show an increase in weight gain, but I have seen some people put on quite a bit of weight after getting the Nexplanon. So I always really push diet and exercise. Very important, no matter if you're on birth control or not. So it's a little questionable as to whether or not you can experience a lot of weight gain with Nexplanon. And the other con is it does not protect at all against sexually transmitted infections, but no birth control, except for condoms, can do that. Very, very rarely do these Nexplanons migrate to other areas of your body. There have been some case reports, and a case report just basically means that there are so few cases that there's not really any information that's available, like scientific studies that are available. Now, when we're talking about migration to other areas of the body, I'm really talking about to like the lungs or large blood vessels. But I have seen Nexplanons actually migrate down in the arm, especially when women have significant weight gain. So the Nexplanon can shift because it's right under your skin. It can shift. If you got flabby arms like me, it can shift down into the flab. So if I'm ever looking for a Nexplanon that seems to be lost, I actually just do an ultrasound all the way down to the bottom of the fat. And that usually is where you're gonna find it. So it may have started out here, but you put on a little extra weight and it gets down here. So that's not really considered a migration, but because it's still in place, but it's just under the skin, and that skin is it's sagging a little bit. So the Nexplanon is sagging with it. So that is very rare. I know that it's out there, so just be careful about what you're reading. I would go directly to bedsider.org or the Nexplanon website itself to read about the actual pros and cons. Some folks may experience nausea, headaches, problems with digestion with the Nexplanon, but these also are pretty rare. I actually have had a few patients too that have told me that Nexplanon did affect their mood. So if you already have a history of depression, anxiety, you may want to think about this with the Nexplanon, and certainly talk to your care provider about your mood disorder prior to starting on Nexplanon. The biggest, most common side effect is the abnormal bleeding. So Nexplanon removal is pretty easy. We go back in, numb the arm up, make a tiny incision right where the Nexplanon was placed, and then push it right back out. So it is good for 3 years, and you can take it out at any point if you're unhappy with it or if you're planning pregnancy. I hope this video was helpful for you in understanding Nexplanon, which is a great option to prevent pregnancy. Make sure you subscribe so that you don't miss a single Well Woman Wednesday episode. And if you found this video helpful, give your girl a thumbs up. I will catch you next week, girl gang. Peace.